Stop blaming your knee if you are having kneecap pain. I had a patient 25 years ago. She came into me with kneecap pain and she was doing all the right physical therapy things. She was taping her kneecap, strengthening her VMO and the inside of her thigh. She was working on her core and nothing was working. What I found out was that it actually wasn't her kneecap's fault. It was actually coming from her hip. When your kneecap is not aligning with your femur bone here, it is either the kneecap is not in good alignment or the femur bone is not in good alignment. So both of those have to be working together for the kneecap to go in this groove and not create irritation. Now, in her case, it was actually her femur that was rotated in. And you might be asking, why was her femur rotated in? Well, it was because her iliacus was tight in the front of her hip. When there's tension in this muscle that's inside your pelvic bone, that causes the pelvis to rotate forward and makes it so that the ball doesn't fit in the socket in your hip joint, and that actually rotates this femur bone inward. So for that patient that I saw 25 years ago, all it took was for her to release her iliacus, 2 sessions of releasing her iliacus, and that was what resolved her knee pain. Use the mark to be able to get into the iliacus. You can use it up against the wall or on the ground. This is designed to curve around your pelvic bone and be able to get at the iliacus in a way that only really a practitioner's fingers can. By pushing down on the handle, it's causing that tip to rotate around your pelvis and get into that spot. After you've had a chance to release your iliacus, then you want to release the back of your hip. The orbit is the best tool to release the back of your hip. The reason this is important is because when you have tension in the front of your hip, with your iliacus, it plays tug of war with the muscles in the back of your hip. And both of these need to be relaxed in order for this whole area to be aligned, which will help that alignment of the femur make sure that it's lining up with the kneecap. Now these muscles are relaxed and your pelvis is in alignment. Now you want to teach your body how to hold that in place. So that patient I was talking about, she was doing strengthening before she did these releases. That's why it didn't work. Now we can use the band to put some pressure on these stabilizing muscles in the outside of your hip to do something even as simple as a bridge that will help those muscles learn how to hold that alignment of that femur in place. So if you want to solve your kneecap pain, you need to start at your hip.